Hi everyone, welcome to Quick Learn. If you are new here and haven't subscribed our channel yet, hit the subscribe button and turn on the notification bell so you won't be missing our upcoming videos. Okay, without further ado, let's get started. In today's session, we will be discussing on chronic obstructive pulmonary disease, which is also known as chronic obstructive airway disease or chronic obstructive lungs disease. Before moving towards the content, let's see the objective first. Here in this section, you will be learning about what is chronic obstructive pulmonary disease, what are the predisposing factors of chronic obstructive pulmonary disease, what are the signs and symptoms of COPD, how COPD is diagnosed, and what can be the management of COPD. Okay, now let's get started. COPD is a term describing a group of disease that involves persistent obstruction of bronchial airflow. It is also known as umbrella disease because it is associated with three different diseases: obstructive bronchitis, emphysema, and asthma. This disease may occur in single but most commonly coexist with overlapping clinical manifestation. COPD can occur as a result of increased airway resistance secondary to bronchial mucosal edema or smooth muscles contraction. It may also be a result of decreased elasticity as in emphysema. Now, as we dig in little further, hereditary and genetic abnormalities, active and passive smoking, recurrent bronchopulmonary infection, occupational exposure, for example, dust and chemical, allergen history to dust, cotton, grain, animal fur and pollen, air pollution and aging are the predisposing factors of COPD. Although the natural history of COPD is variable, it is generally a progressive disease characterized by three primary symptoms: chronic cough, sputum production, and dyspnea. These symptoms often worsen over time. Chronic cough and sputum production may interfere with airflow. However, not all people with cough and sputum production develop COPD. Dyspnea may be severe and interfere with patient activities. It is usually progressive and worsen with exercise. As COPD progresses, dyspnea may occur at rest. Moving further, weight loss is common because dyspnea interferes with eating and the work of breathing is energy depleting. In patients with COPD who have a primary emphysematous component, chronic hyperinfiltration leads to the barrel chest thorax configuration. Now, let's see how diagnosis is done. Pulmonary function studies are used to help confirm the diagnosis of COPD, determine disease severity, and monitor the disease progression. Spirometry is used to evaluate airflow obstruction, which is determined by the ratio of forced expiratory volume to forced vital capacity. Similarly, arterial blood gas measurement may also be obtained to assess baseline oxygenation, and gas exchange are especially important in advanced COPD. A chest X-ray may be obtained to exclude the alternative diagnosis. Once the diagnosis is done, management is taken under consideration. While managing the patient of COPD, first of all, severity of disease is evaluated. For the patient with stable disease, treatment aims to reduce risks and symptoms. Smoking cessation is the single most cost-effective intervention to reduce the risk of developing COPD, whereas breathing exercise can help with ineffective breathing pattern. Similarly, people with COPD have decreased exercise tolerance during a specific period of day, especially in morning because of bronchial secretion that have collected in lungs during night. So, nurse can help the patient to perform self-care activities in order to prevent from respiratory distress. Likewise, bronchodilator, corticosteroid, and other medication like alpha-antitrypsin therapy, antibiotic, mucolytic agent is given to improve pulmonary function and to decrease symptoms of COPD. That's all about chronic obstructive pulmonary disease. If you find our video useful, don't forget to like and share among the friends. Thank you.